let's get started with our next session. Um, so now we would start with the second session for today. That is our industry panel discussion. And the topic for today's panel is very, very relevant for all of us. That is challenges and opportunities presented by COVID-19 for data science community. So Karthik Sankaranarayanan would be moderating this interesting conversation. So I would like to quickly introduce Karthik to all of you and then hand it over to Karthik for introducing the rest of the panel. So Dr. Karthik Sankaranarayanan is a senior technical staff member and senior manager in artificial intelligence at IBM Research, where he leads a team of scientists and engineers working at the intersection of deep learning, natural language processing, and computer vision. His work has received several technical accomplishments, including IBM Corporate Award. He also serves as the IBM Principal Investigator for IBM and IIT Bombay AI Horizons Network. He has received his PhD from Ohio State University, and he is serving as a co-chair for this year's COTS Comat Industry Track. And on personal note, I had absolute fun working with Karthik over the last several months while preparing for this conference. So over to you, Karthik, for the panel discussion.
Thank you, Tanuja, and likewise on the fun with organizing this industry track. Thank you. Thank you, everyone. Welcome. Thanks for joining. We have an extremely interesting panel discussion ahead of us, talking about the intersection of COVID-19 and data science. And as you can imagine, right, if I just take your minds back to March or April of this year, when the pandemic was raging through the country, we didn't know what we are confronting. A lot of people in the data science community in particular got together and started working on in terms of how we could tackle this pandemic that we are looking at, right? And these were in terms of areas directly affected by the pandemic itself, like studying the disease, the spread, all of that, right? But also sectors which were indirectly affected, like supply chain, transportation, video conferencing, and things like that. And enormous opportunities for data science. And we couldn't have a better panel to talk about everything that the data science community has been up to. We have panelists spanning all pillars of the data science ecosystem, ranging from academia, industry, working with nonprofits, policymakers, volunteer communities, and so on. So without any further ado, I wanted to introduce the panelists. But before I do that, let me just give you an overview of the format we're going to follow today. We'll break up the panel discussion into 3 parts. So for the first part, the panelists will provide opening remarks from their end for 5 minutes each. After that, we will have some questions by the moderator, which is myself. And meanwhile, feel free to post your questions in the Q&A feature at the bottom of the Zoom window. And we will have the remaining time to take all the audience questions. All right. So let's get started. Let me introduce the first panelist, Dr. Srujana Merugu. Srujana is a good friend of mine. I've been knowing her for quite a few years. She's a machine learning researcher who's currently consulting with both Google Research and Vadvani. And she's a keen interest in platform dynamics, data governance, human behavior, education, healthcare, and financial inclusion. She's had a very enriching career. Prior to 2017, she was working with machine learning research groups at Yahoo Research, IBM Research, Amazon, Flipkart, all kinds of industries and sectors. And post 2017, she's been involved in consulting engagements with startups in education, healthcare, and different domains, volunteering on social causes. In terms of her education, she obtained her MS and PhD from UT Austin and her undergrad from IIT Madras. So over to you, Srujana.
Hey everyone, it's great to be here. Thanks, Karthik, for the introduction. Yeah, hi. Would you like me to go ahead and speak, or for you going to introduce the other speakers?
Yeah.
All right, just 1 second, yeah. Just 1 second. Just give me a moment. I always struggle with these things. All good? Yeah.
Yeah.
So hi again. It's really nice to be here with the other panelists, and thanks so much, Karthik and Tanuja, for inviting me. So as you all know, the COVID pandemic has turned most of our lives upside down. In fact, same with me too. But at the same time, what I feel is that it's teaching us these very valuable lessons that are critical for finding our place as a community of data scientists in the overall scheme of things. And this is especially important as we face the defining challenges of our generation, such as the climate change, the consequences of automation, and societal divides of all sorts. Now, on the COVID projects itself, some of us started out in March as a volunteer group of data scientists, mostly researchers, but with the firm conviction that our effort had to be focused on the human impact and not become a mere academic exercise. So while on one end we started fleshing out technical problems and solutions, we were also actively reaching out to the various government task forces, war rooms, and a lot of other organizations that were trying to pitch in just like us. And as we interacted with various stakeholders, we realized that our ecosystem was highly fragmented. There were multiple private and government organizations responsible for health surveillance, care delivery, planning, and policy making. Even the ownership of data, the modeling expertise, and the engineering skills were distributed across multiple entities. So we data scientists were sort of like these folks sitting in this yellow box, wondering where the data is going to come from, who exactly will use what we build, and why would they use it and how. So just to cut the long story short, we realized there was not much scope to make a difference unless these gaps were somehow filled out. So to bring order to this modeling chaos and deliver value, it was critical to gain a better understanding of end user requirements and also create these data and model management layers, the green boxes here. And this was highly non-trivial. And despite the best efforts of multiple groups, this still remains a challenge. So let me now talk a little bit about the problems that emerge in the management of a pandemic. Essentially, what we need is a control loop. So there are three steps here. The first one is observing the state of the pandemic, and that involves monitoring various aspects such as the mobility, the disease and economic impact, the situation with testing, medical care, vaccination, and so on. And the second one is making decisions on the levers that we control. And this includes lockdown policy, testing, tracing, medical planning, and now vaccine allocation. So making the right choices here can result in a huge difference. Right now, implementing these choices and executing on the ground is a third equally important task. So together, these three steps complete the loop. As intelligent agents, we humans execute this loop all the time. In the case of a pandemic, however, the entire social collective needs to act as a unified agent, and we need to build these systems to close this control loop. And also because the clock is ticking all the time, we need to be fast and smart. And that's why a data-centric strategy is very critical. Essentially, what we need are data-driven systems and an organizational structure that can be roughly imagined as a response pyramid. So the bottommost layer here deals with driving execution, and it comprises teams on the ground such as testing, tracing units, hospitals, and so on. And the next layer is all about collecting and managing data in an ecosystem of apps, databases, and pipelines to make sure it's actually usable for decision making. And the data science and analytics layer involves interactions between domain experts such as epidemiologists, economists, and data scientists. And at the very top of the pyramid are the folks responsible for making decisions, which is typically the government officials. So as you can imagine, the data here flows upwards, getting progressively more insightful, while decisions and guidelines flow downwards. Right now, let's look at the data science layer itself. So broadly speaking, there are four areas of interest. And we had to work as part of our projects on all of these aspects. So the first one involves deciding on the combination of lockdown policy, medical preparedness, and testing levels. And these three are interrelated because if you don't have the medical capacity, then we need stricter restrictions. So making the right calls here requires being able to forecast how the economic and disease impact will pan out for various policy choices. The second area of analysis deals with optimizing the testing policy. Whom to test, when to use what type of test, what schedule, what allocation across demographic and geographical groups. And this requires understanding the test sensitivity, exploring allocation algorithms focused on maximizing the overall utility, and so on. A third area of analysis deals with medical care policy and allocation. And again, this entails identifying segments that are experiencing high severity and fatality levels and reallocation based on the modifiable risks. So a fourth upcoming area deals with vaccination. So if you think about it, each vaccination is like a transaction that involves a vaccinator, vaccine supplies, and a recipient that needs to be scheduled at a physical place and time. So this is very similar to the e-commerce domain, and there's a need to authenticate different actors, plan the eligibility rollouts, trainings based on forecasts, and optimize the sessions accordingly. Now, these are all great data science problems, but solving them is not easy because there's a heavy dependence on the data collection and management layer, which unfortunately is ridden with numerous problems. So there are three salient issues to consider. The first and the foremost is the representation itself. So unfortunately, the very definitions of these essential concepts, right? What is the positive test, recovery, COVID death, these are inconsistent across regions and times. So it's critical to define these semantics, the data schemas and identifiers with domain experts and IT experts in the loop. That unfortunately is not where it should be. And apart from the representation, the data entry process also requires a massive rehaul. So though we have a lot of apps, the usability is pretty low. So in the field, there's heavy usage of Google Sheets that can be edited by multiple users, and these neither scale up nor do they have proper validation at the point of entry. Now, the third aspect involves intelligent and scalable processing of all data. And I mentioned the data service layer early on, and all those aspects related to storage, privacy, security, compliance need to be solved. And as a country, we are not quite there yet. But that is exactly where we need to go. Essentially, what my wish list for this community is that we would build these three green blocks as public goods, and this correspond to what I feel are three key lessons on being effective. The first is that we need to develop an outside-in mindset and work backwards from the real impact and pain points, and not just limit ourselves to the cool-sounding mathematical part of the modeling. The second is to pay attention to the data layer. If things are not quite the way we want them to be, we just need to roll up our sleeves and fix it, because otherwise it's a case of garbage in, garbage out. And lastly, we need to develop collaborative solutioning frameworks where problems and metrics can be shared widely via model service layer to allow good solutions to emerge quickly. At this point, just wanted to mention that there is this effort around National Digital Health Mission in the healthcare domain, and I hope to see more activity around it, because that's precisely targeted towards building these layers. Thank you so much, Karthik, and yeah, let me stop sharing now.
Thank you, Srujana.
Thanks, everyone.
Very fascinating.
Yeah.
We'll come back to more questions for Srujana during the Q&A part. Let me now introduce the second panelist. So we have Professor Mitesh Khapra. Mitesh is an assistant professor in the Department of Computer Science and Engineering at IITM. He is also the co-founder of 1/4 Labs, which is a startup focused whose mission is to design and deliver affordable hands-on courses on AI. So if you've been taking interesting courses in AI, you should definitely check out 1/4 Labs if you haven't already. He's also the co-founder of AI for Bharat, which is a voluntary community with an aim to provide AI-based solutions to India-specific problems. On the academic side, his research interests span deep learning, multimodal, multilingual processing, NLG, dialogue, question answering, and Indic language processing. And he has several publications in top-notch AI conferences and journals. Prior to IITM, he worked at IBM Research in the areas of machine translation, argument mining, and deep learning. And before that, he obtained his PhD and master's from IIT Bombay in Jan 2012. So over to you, Mitesh. Tell us what exciting stuff you're up to with respect to COVID-19.
Yeah, thanks, Karthik. I'll just share my screen.
Sure.
Can you see the screen? Can you see my screen?
Yes.
Yeah. Okay. So
Yeah.
I'm going to talk about at the beginning of the pandemic, right, when the government had also announced a few hackathons around COVID-19 and was looking for solutions for various aspects, right? And this was nicely captured by Srujana along the different layers, starting with information dissemination to policy decision making, to planning the medical facilities and so on, right? So one of the things that we are trying to do in that direction was to make a bot, and I'll tell you the context of in the context in which this bot was planned, right? So if you go back to March 2020, right, and there was a lot of confusion around COVID-19 as opposed to the situation today, where like all of us have become experts in the difference between RT-PCR and antigen tests, or mRNA vaccines and DNA vaccines and so on. But earlier on in March 2020, I think there was a lot of confusion, a lot of misinformation in both extremes, right? On one side, people were like, okay, this is all just going to go away once the summer starts and we don't need to worry about it. And the other hand, there were like these doomsday kind of predictions on what the number of cases and deaths in India would be and so on. And there was also even like very basic things like how does the disease spread, and then what are the surfaces through which it spreads easily, how much time does it stay on the surface, the AC versus non-AC effect and all that was also not very clearly known, right? So in the context of all this, there was again the additional challenges that we started somewhere around March 15th when the lockdown was also not announced, but there were clear indications that something like a lockdown will happen soon. And then there were these additional challenges which would come up, that how do you manage people during the lockdown, right? I mean, how do you ensure that people who need essentials get them and who cannot get out of the house or who are alone, say elderly people, how do they get all these facilities, right? So in the context of this evolving situation, we had planned this bot with the following primary goals, right? One was the dissemination of correct information. So if you have any queries about what you should do in which situations, at that time, for example, if you have symptoms, it was not clear who should you call. Should you just go to your regular family doctor, or you should go to a specific hospital? And if you have to go to a specific hospital, which are the hospitals closest to your area, right? Even at that level, information was missing because it was still an evolving situation, right? And then second, about risk assessment, there were again lots of theories floating around who is at risk, and if you have certain conditions, then what happens. If you have cold and cough, does it necessarily mean it's COVID, or there are additional symptoms that you need to check for? And at what stage you should prefer home isolation as opposed to immediately rushing to a hospital because you belong to a certain group of people who are more susceptible and whose condition can deteriorate immediately, right? So those things were also not known. So we had joined hands with a few doctors from JIPMER and tried to come up with a systematic assessment form, right, where people can enter their details and get to know what is happening, right? And then the last part of this was to connect volunteers to help seekers. And I'll speak about each of this in detail over the next few slides, right? So first, coming to dissemination of correct information. So again, this was not just from the public point of view, but from different points of view, right? On one hand, as a common man, you're interested in knowing what is happening in your area, how fast are the cases spreading. Then there's an academic angle to it where people want to be able to build models and be able to do predictions. And then there's, of course, this government and decision making or policy making angle to it, where the government wants to know what are the different things happening on an hourly or even say 6 hourly or half day basis, right? And so one thing that we were planning to do at that time was build this conversational data science bot, right? So you ask it questions like, can you draw a plot for the number of deaths in China from February to March, right? So a lot of statistics were floating around, and there was a lot of interest, a lot of beautiful plots which were coming around the initial days of COVID, clearly summarizing what the situation is. And there was an increasing demand for everyone to see this, right? So that even say top decision makers in say the IT industry or in IT parks can decide whether they should opt for a long-term work from home or what kind of policies they should make. And a lot of these statistics were helping them in making these plans, right? So our job was to gather these statistics from various sources. At that time, even COVID-19 India was had not become popular yet. I think they had started off, but they were not yet popular. They were not the single source of information at that time. And so you are getting information from various ministry health websites and then trying to present it in a form where it's easy for people to take decisions on what should be done or be cautious about the spread of the disease in their own areas and so on. And so that's something that we were developing as a part of this bot. Then, as I said, we had this risk assessment where we got together with doctors from JIPMER and they help us understand all the different decision points that a doctor takes, right? Again, this is March, April time where the doctors were also continuously getting updated guidelines on what is correct and what is not correct and whether certain things are associated with COVID or not, right? For example, it was not very clear where if what is known as Madras eye, right, which is similar to conjunctivitis or sore eyes, whether that's associated with COVID or not, right? And those kind of checks were being constantly updated in the app. And if you have those symptoms, there was a clear guideline on who should rush to the hospital versus who should go in home quarantine versus who should go in isolation and so on. Right? So we are trying to provide this information through a form which the user fills with all his information, including past diseases and so on. And then that helps them to take the right call and also further information on which are the nearest centers to contact and so on. Right? So this was more to manage the initial medical situations, right? In the sense of whether how do you go for testing, how do you get admitted, and when do you get admitted, and so on. And the last part of it was, again, during the lockdown, we heard many stories of how people were stranded and how they were not being able to get access to many essentials. And I also had some personal experience with relatives in certain parts of the country, especially elder relatives who were staying alone. It was difficult for them to venture out because they were really scared about, again, partly due to misinformation and partly due to the situation. That was not clear whether they should easily step out, whether the mask was enough to protect them or not. In this situation, how do you get groceries, right? At the same time, in India, whenever some disaster happens, we always have a good, solid support of volunteers who are willing to go out of their way to help people. And it's a matter of just connecting these volunteers to the help seekers, right? So we had come up with some utility in the app where you can enter what are things you need, what are your area, what is the area that you reside on, and then you will be shown the volunteers which are within a small radius around you, and then you could contact them by phone, and then they could help you in getting these essentials, right? So this is all that we were trying to do early on in March, and we had submitted this as an entry to the, I think government had one COVID hackathon or a smart hackathon at that time, and we had submitted it to it. But yeah, this did not go further. And while doing this, right, so we realized a few challenges that are there, right, in any such situation. And as Srujana was also trying to say, right, these disasters are only going to become more and more common, either the pandemics or other natural disasters as we go along due to climate changes and other things. And these situations where we are trying to deal with something which we have not seen in the past is going to recur. And one crucial thing in all of these, right, even if you look at the cyclones which happen frequently in the coastal areas, at least on the eastern coast, you would see that a lot of thing is about the right information dissemination, right? So you have people who are stuck at some point, they don't know what the situation is, whether the cyclone has resided or not, whether they'll get help or not, whether they will get the necessary essentials or not. All of this is required. And in particular, you need to connect the volunteers to the help seeker, right? So this is like a recurring pattern in any kind of disaster or pandemic or such severe situations. Now, one main challenge that we face, right? I mean, we build this app, okay, you're trying to disseminate information, you're trying to collect volunteers to seekers. But then who is your end audience, right? Who is the target user base for this app? And a lot of them are going to be people who are not fluent in English, right? And how are they going to be able to use or communicate with this app? Let's take a simple thing that I am someone who does not speak English and I'm not comfortable in typing on the mobile, right? Think of an elderly citizen. And I want to be able to communicate with the app or with the people behind the app in my native language in Hindi. Now, what is the right way of doing that? I don't have good keyboards for Hindi. I don't have a good way of course, now things are improving and we have good speed systems and all, but it's still not there for all the languages that we care about, especially for the different, at least the languages which are so-called low resource languages. They might be there for Hindi, a few prominent South Indian languages, but not really for all the languages that we care about, right? So this became one of the major challenges. So we wanted to deploy the app for user testing. Now, the immediate feedback when we started talking to people was that how will a person in a remote village in Tamil Nadu be able to use this? Because that's the person who needs help because he does not have information. People who are in cities, they are watching their TVs, they have their mobiles, they are already getting all the information that they can. So how is your app going to serve? And then this brings us back to what we have been trying to, the data science community or the NLP community has been struggling for many years, that we just don't have the right tools and technology for Indian languages. And that is one area that needs to grow, right? As we keep growing, our needs grow, our digital presence increases, the rate of such disasters increases. It's going to be very, very important to cater to a large multilingual user base in the language that they talk and understand. Right? And the last two bullet points on this slide are very much in line with what Srujana was saying in her pyramid, right? So there's different levels at which things happen. At the bottom layer, you have perhaps people who are on the ground and trying to get things done, right? They are the ones who are interacting with the people on the ground, trying to collect their information. And that is very, very important, right? You cannot just sit in your home and office and try to design solutions for people that you have never interacted with. So having a good ecosystem where it's very easy to connect academicians or industry to NGOs and through them to the people on the ground is very, very important. I think that ecosystem is lacking, right? We don't have a systematic way or say a body which acts as a central nodal point for connecting various stakeholders in the system, right? Be it industry, government, NGO, and so on. And the third thing that we realize is that without government support, right, it's impossible to deploy things at scale, right? So again, this was in March, and then around April or May, government developed its own app called Arogya Setu, right, which many of us used and still perhaps use it. And that could really scale to much greater heights because it had the backing of the government, right? So that is also very, very important. So again, having the right connect between people who are actually suffering and people who are developing the solutions, which may be academia or industry, and the government who has the wherewithal of getting these things deployed, that is very, very essential. And that ecosystem needs to be developed so that the next time things like this happen, we have a clear path of how to connect people and how to get things done in a timely manner. Right? So that's the main message I would like to give. So that's all, everyone. I'll stop now and later on join back for the questions.
Thanks a lot, Mitesh. So we'll now move on to the third panelist. Let me introduce the third panelist. Our third panelist is Dr. Harshad Khadilkar from TCS. Harshad is a research scientist with the research division of TCS, where just hold on. Yeah, where he leads the planning and control team based in Mumbai. He's also a visiting associate professor with the Aerospace Engineering Department at IIT Bombay. He holds bachelor's degrees from the same department, and he has master's and PhD degrees from MIT. His main research interests are in control and reinforcement learning algorithms for network systems. So over to you, Harshad.
Thank you, Karthik. Yeah. Right. Thank you for the introduction, Karthik. So I'm going to speak briefly about some things that Srujana and Mitesh covered already, but going beyond that as to moving away from the direct human impact of COVID-19 towards things that actually help people carry on with their normal lives despite the pandemic. So looking at it from a company perspective and from a supply chain perspective, how to keep things stocked in stores and how to make sure deliveries to people are happening on time and so on. So I'll be focusing on the automated decision making perspective of what happens during COVID-19. Having said that, we do recognize that the things that happen directly from a human impact perspective are very, very important. And one of the things that goes under the radar is how big corporations, how fast they had to react despite their size and so on. So to take the example of TCS, more than 440,000 employees had to shift to a remote working model within the space of 1 week. And there was this development of the secure borderless workspaces, which became a long-term solution and is still going on, and has been deployed with a lot of our customers as well. But there's a lot of data science, cybersecurity, and other aspects that go into developing systems like these. And especially when these things come up unexpectedly and suddenly, then developing this properly becomes an issue. So there are definitely challenges in things like that. And of course, TCS had 30 plus initiatives working on different COVID related challenges, details of which are in the URL I have put at the top of the slide. And examples include micro simulation for modeling spread in communities, which is still happening in Pune, and the digital classroom that TCS Ion had developed, and so on. But keeping this in mind, I'm actually going to focus, like I said, on what we can do from an automated decision making perspective. And this is important because when huge events like the pandemic break, there is a lot of information that is generated and not enough decision makers to actually make sense of the information and decide what to do about it. Right? So, one of the important things that we saw during the pandemic were the modeling of the disease, which is on the right hand side of the slide. So you have people moving from susceptible states to exposed states to symptomatic and asymptomatic carriers, and then to recoveries or to deaths. So finding out what are these graph connections and how people move from one state to another, how fast they do it, and what are the probabilities was the focus of a lot of the medical community. And then there was the data science community, which was also looking at predicting how the disease would spread given the connections in a network and so on. So the strength of connections in India are shown on the left hand side of this slide and so on. But given all of this information, it was not clear how a decision maker like a government would be able to use this information to decide practical things like when to use lockdowns and where to do them, where to declare lockdowns and when to open them up. So one of the things I did with my former colleague Tanuja, who was hosting the previous session, and another former colleague Deva, was to look at can we use data science techniques like reinforcement learning to optimize when lockdowns happen and where they happen, based given the disease parameters and the network connectivity parameters and so on. So the things that are happening and that are not in our area of expertise, we assume that people would be able to give us models for these. But given those things, can we actually decide when the lockdown should happen, depending on how the disease is currently spreading and so on? And so we came up with this algorithm, which was published in the transactions of the International Association of Engineering. So that was one aspect that we looked at. But another thing that we focus on in TCS, more importantly, was how to make sure that people who are now, who were going to stores or who were going to offices, are now sitting at home and they are expecting groceries and other essential items to be delivered on time and as soon as possible in many cases. How can we help our customers who are retail businesses? How can we help them make sure that these deliveries happen as before, despite the rise in demand and the severe changes in the demand patterns? So the first thing we looked at for a retail business was, can we improve the e-commerce delivery fulfillment times without actually affecting how the process, individual processes happen, but using data science to predict when the products would be requested by customers and in what quantities they would be requested. So we could actually help our retail customers pick these products from their warehouse overnight and keep them ready close to the packing area, so that when the orders flooded in during the daytime, you could quickly just package these products, label them, and ship them off. So you did not have to expose your labor to extra working hours or to get suddenly extra labor, which was anyway not possible during the pandemic. So one of these things we trialed with a large retailer in the UK, and it turned out to be fairly successful. And the paper around that was actually coincidentally published in this conference itself in the industry tag. And finally, there is the point of how do we control an entire supply chain, a retail supply chain, to make sure that stores are stocked despite the severe changes in demand patterns. So you can't really expect an IT team to go in and change all the rule-based heuristics and all the other algorithms that go on for replenishment in supply chain. So to give an example, your regional warehouse, which directly gets supplies from vendors, could have timescales of the order of a few months when they set up contracts with vendors as to what quantities will be delivered. But the warehouse has to send, the regional warehouse has to send products to the local warehouses much faster than that, maybe once a week. And the local warehouses actually have to send products to stores every few hours. So the time scales of these loops that you see in the figure are very different, and making sure that they work smoothly despite the severe changes becomes very, very tough. And this is where another of our product offerings, TCS Optimera, could help customers, where we were using reinforcement learning to figure out what the replenishment quantities of each product should be, while making sure that it satisfies all the constraints that you have in your system, whether it is labor or capacity or vehicles, whatever it is, and react to changes very, very quickly. So you could have maybe the option of using 4 trucks on a given day, but only 1 truck is available the next day, and so on. So when these variations happen suddenly and unexpectedly, how can you use data science based techniques to adjust to them and make sure that the stores at the end of the day are stocked as well as possible, especially with the high priority items during the pandemic, which were your groceries and other medical supplies and so on. So I just wanted to bring out some of these things which we kind of never see as people who are affected directly by the pandemic, as to how big an effort goes on in the back end to make sure that the things we expect to reach at our homes get there on time and in the correct quantities. Yeah. So Karthik, that was what I wanted to bring out.
Thank you, Harshad. Thanks for that. Cool. So we're now done with the opening remarks from each of the panelists. We'll now move to the second part, which is around Q&A. Okay. So let me begin with, so one of the first challenges is around making sure you have the right data for all of this, right? So let me take the question to Srujana. Could you tell us a bit about some of the interesting challenges with building the right data pipelines for this project, right? A source of the data, quality of the data, scale of the data, and all of that?
Right, yeah. There's a lot to say there, Karthik, and I think that's a very critical part of all of these efforts, right? So our team at Vadvani and the consortium was involved with the government's response, like Mitesh and Harshad described. There's a lot more beyond that. But since we were primarily involved with the government response, the data we looked at included case counts, hospital bed capacity, case line list, test line list, and so on. And this was mostly from the city or the state war rooms and the ICMR portal. And in some places like Mumbai, we helped with the pipeline. So we also had data from facilities like hospitals and ward offices directly. And the scale, yeah, well, when it started in March, the case counts were in double digits, right? And now, of course, it's in lakhs for even, a reasonable size region. And I would say on the quality side, well, the mandatory fields are usually okay, but the rest of it is a mess, like address, symptoms are all a mess. And this, I would say, a lot to say about the challenges we face, because the definitions are off, schemas, design of ID and all of that will be, there's a lot to fill in there. Like we don't even have proper unique patient identifiers, right? But I just wanted to call out one important issue, because I'm sure Mitesh, others have more to add here. But one important issue that we faced was that, this is not just because of, a lack of effort. It's actually a tricky problem because there are multiple sources of data, right? The data is being collected from testing labs, ward offices, hospitals, call centers, mortuaries, right? And the schema is not the same, the update frequency is different. So when you see a sudden spike in deaths or recoveries, it's not that all of that happened the previous day. It's just this backlog that they have reconciled. So because of all of this, what we had to do was have scripts which merge data across different sources, validate, normalize the data, identify linkages, geomapping, and so on. So essentially the main thing is we need a system which can hook up to different heterogeneous sources with different update frequencies. So that's one thing I wanted to call out. Yeah.
Cool. Thank you, Srujana. Mitesh, do you want to add anything, particularly with respect to the bot, right? Since this is end user facing, a lot of people are going to have to trust the responses from the bot. So do you have to say anything about that?
Right. So here again, right, I think some kind of, as Srujana said, right, centralization of data wherein the trust comes in, right? So now if you say that now whatever a risk assessment, for example, right, if a person does the risk assessment that the bot does, now it has to be backed by some centralized data that this is coming from these set of doctors, it's based on these set of guidelines and so on. And these were not so systematically highlightable at the beginning of the pandemic, right? I couldn't point that this is the guideline that I'm referring to, or this is the particular article which says that this is what needs to be done and so on, right? So a central repository where all of this can be collected. And the key word here which Srujana used, right, was this heterogeneous data sources, right, coming from different schema and each having their own shortcomings in terms of how they organize data, missing data and so on. So we don't really have what is like a government level data lake sort of, right, where all of these are stored and then they can be accessed at any given point. Not just that, right? Even various basic tools, for example, right? So now a lot of in the pandemic, this geo mapping was very, very important of different things, right? In terms of hospital facilities, testing centers, and even for locating clusters of patients which are there, right? And all of us were mainly relying on Google APIs for doing this mapping, or maybe a bit of open street, right? Open maps. But then what do we have at a India level or at a government level which facilitates that? Right? Do we not have our own satellites from which we can get this map data created, right? And then use it more freely as opposed to relying on these third party, which is again adds to some blockage in terms of how many times you can use them and so on. Right? Mm-hmm. So that's again, these basic data layers, right, or data operating layers are also missing for the Indian stack. So that's also something that needs to be focused on going forward.
Interesting. Good to know. Harshad, do you want to add anything from the enterprise perspective, particularly the data related to supply chain and logistics for to be used for e-commerce? Into that?
Yes. So actually building on what Srujana and Mitesh said, agreed that these are all very significant challenges, but it also turns out that they can be used as opportunities, because when something very large hits like this, both enterprises who are our customers and government suddenly realize that it is important to have these data sources in place, even though there is no obvious immediate application for this. Having good clean data and sources that are trustworthy is important, just because you don't know what would be coming in the next 5 or 10 years. And the thing with data science is that usually you cannot work with data that has been just started after the actual event hits, right? You need some amount of historical data to train these algorithms and to get something that is useful out of the data science algorithms. So we have been able to, I think, push a lot of digitization into our customer systems because of the pandemic. So it can be used as an opportunity.
Thanks, Harshad. In fact, that was the second thing I wanted to ask all of you, all the panelists, which is about the speed of development of solution due to the sudden nature of COVID, right? Mitesh, do you want to talk about how developing the bot in such a context is typically different from a standard developing a conversational NLP bot, right? What were the unique challenges with developing things at blazing speed?
Yeah. So I think challenges, of course, yes, but more from an difference point of view, right? I think developing something which is for a very specific domain has certain opportunities there, right? Because we are not really trying to develop a general purpose chatbot, very specific questions. So it's almost like an FAQ list, and then trying to have some variants of these FAQs, right? So that was definitely easier. It is not very difficult to develop it at fast pace, right? I mean, because you quickly create this taxonomy of questions and then try to have some of the basic NLP tools work with them, right? So that was possible for the English part of it, right? And also this technological stack, right, for bots and all is now pretty mature, right? There are different services available which readily allow you to integrate with a working bot, and then all this interface of typing in it and all that is readily available, right? So it's not very difficult to put those pieces together and get them to work, right? So again, as I was saying, the main challenge there is that if you have to have your bot which relies on some kind of past data, or if it relies on catering to a wider multilingual user base, right? And that's where you cannot develop things in at lightning speed, as you said, right? Because that is a technology stack which has to get developed over years. And today, if I just want to have a simple support that whatever FAQs I have, if I just want to be able to translate them, or if I want to be able to translate them into multiple languages, not the top languages, say, which Google, Microsoft, and others cater to, but also looking at the languages going below the top 15 languages, right? So that is something which acts as a hindrance, and we really couldn't do it in that short period of time. Like we can't really scale up. Even now, today, we cannot really scale it up to that, right? So we have to focus on what are these technology blocks which are recurrent in many of these situations. Language being one which comes to my mind mainly because of my experience in working in NLP for many years, and or maybe because that's the only thing that I know. So that's why that comes to me first. But there are other such things that we can identify, right? Even say, for example, satellite data is another thing that we say. And these things have to be kept ready so that whenever the opportunity arrives, you can quickly do a plug and play and get things ready, right? So right now, these essential technology pieces are missing for different things, and we have to work towards getting them done, right? So that's one important area to work on.
Right. Cool. Okay, the other thing I wanted to ask each of you guys was, see, typically as machine learning folks and data scientists, we were just on the data science modeling part by ourselves, right? Locked in our offices. But these projects that you guys talked about clearly shows the importance of partners and community involvement, right? Could you talk a bit about like some of the unique challenges there? Like Mitesh, you mentioned working with JIPMER doctors, right? What are the challenges in working with such partnerships and things like that?
So I think there the main thing is to find a partner who aligns with what you want to do, right? So I'll give you an example where things can go wrong, right? So when we talk about especially AI and data science, I think there's this clear divide between what people expect from it and what in reality is possible, right? And then when you go to people and say that, okay, I want to build something which is AI enabled for the COVID situation, they just start expecting the sky from you, right? In the sense that we'll just put an end to everything and we'll be able to streamline all the movements across country and everything will be solved, right? So that is something which becomes a big challenge in communicating with people who are not really aware of what the reality in terms of delivery is, right? I mean, you could expect a lot of things and maybe in a few years we'll get there, but what is the current state of the art which is really useful, right? So now at that point, if you ask me, for example, one of the things that we were discussing with the doctors, they had a few images of these chest X-ray scans, right? And from them, they wanted to be able to automatically diagnose this. Right? Now we have to put our foot down and say this is not possible. Right? If you just have like 10 images, 100 images, then that's not enough to really train a model. You need data at much larger scale and be able to convince them that this data collection is the primary thing. Right? That's the real hero in data science. Unless you really do that, it's not going to happen. So a lot of part of when we interact with NGOs, hospitals, or other entities goes in convincing them about the importance of data, and not just data, but clean, usable, labeled, supervised data. Right? I mean, you have tons of data in your organization, which is maybe a lot of these. I mean, in fact, we spoke to some hospitals which are pretty famous, but a lot of their data entry is still on pen and paper. Right? So they say that we have everything recorded on pen and paper, And now we are trying to digitize that. So there's a lot of data available with, can you go and use it? So I think I can't use pen and paper data. It has to be digitized in some format, and not just digitized, it has to be in some structured format that we can work with. And it takes, you won't believe this, but it takes a while to convince them about this, right? That this is important. And then at times we get looks as if this guy doesn't really know how to solve our problem. So he's finding excuses and saying that your data is not good. That really happens, right? So I think that education at different levels about what AI is, what is the real reason, and which are the situations in which AI can succeed. That education is missing at various levels in the non-industrial areas, like for example NGOs, hospitals, like the non-technological verticals, right, where AI can be applied, government being other. And sometimes even in the industry, when I talk to people, I feel that expectation is a bit misaligned, right? I mean, because see, primarily, for example, if we talk about the IT sector, uh, we have achieved remarkable things there, right? But at the same time, the expectations there are different. If you develop a website for a client, it has to be zero bug, right? I mean, it has to work 100% of the times with no breaks. But now we know AI does not really have the same kind of level, right? I mean, so when we have these discussions, 99.99% accuracy comes up on day one, right? And that cannot be done, right? Because we can't really have that. So I'm just giving you one example, but similarly setting the right expectation, right, base expectation across different sectors and educating people on what to really expect is very, very important. Right? Otherwise, these discussions don't progress and there's dissatisfaction on both sides. Right? It seems that we are promising something which is not possible, and so that it does not lead to any meaningful engagement. Right? And second is that systematically across all sectors in government and across the country, right, this collection of data should now just become like a mantra. Right? I mean, that's the one thing that everyone should be doing in a systematic manner, and no questions asked about it. I mean, that is how you are going to be able to implement AI in the next 10 years. So that education needs to be driven down. Right?
Cool. Very interesting. Very true. Each of those factors. I'll take that same question to you, Srujana, in terms of importance of working with partners and the community, right? What were unique challenges? And there's a related question. I'll also throw that to you. There's a related question from Gautam. Did you face any data sharing issues, like human issues, right? Concerns between states and various departments and things like that.
Right. So let me get to the data sharing, right? So the way we've worked, what we've seen is that, apart from the legal agreements, there are barely any enforceable privacy safeguards. So data sharing depends a lot on trust and which organization you are, because, there's no way to enforce it otherwise, right? So that's definitely there. And there's a lot of other things that come up, like, people have issues, like these are all political entities, right? So there's a lot going on there. So it's not as seamless as we would like it to be. Now, coming to partnerships and community and stuff like that, right? So I definitely, I'm so grateful for all the different people I've met as part of this effort. A huge fraction of them were just volunteers pitching in. If you just think about COVID-19 India, right? That's a completely community driven effort, and that made a big difference to us, despite not having a government backing. And essentially the idea here is that, it's rare for a single organization, forget an individual, to have the expertise required for all these different layers of work, right? And for data science professionals, it's very important that we approach this whole type of effort with humility, because we might be good at math and algorithms, but the problem definitions, assumptions of data, and like Mitesh called out, right, the data itself might not be there and it might be missing and so on, right? So we really have to partner with others to be able to get this working. And the other thing to remember is, coming up with like data science insights, projections, all of these predictions is only part of the job, right? Ensuring that somebody else adopts it, that these insights are correctly understood, right? It requires a lot of education and communication. Again, like Mitesh was saying, so in the early days, there will be inaccuracies, but as we collect more data, it will progressively get better. And we need to also communicate it in a way that it's factored into the decision making properly, and that's a whole new ball game. It's like, really being able to persuade people that this makes sense in the long run. And this is something where we really need partners who are educated, open to understanding, and we need to also work on it. So that's what I would say here, right? It's really important.
Yeah.
Harshad, I
Karthik
want
actually,
to, yeah, go ahead.
yeah, just wanted to add one point to what Srujana said. It's very important this contribution that volunteers and volunteer organizations had. But I think for the next time something like this happens, we should not be having these discussions after the event happens. I think when
Right.
things are quiet, we should be having the conversations about how to build this ecosystem so that we don't have to rely on ad hoc support from volunteer organizations to collect and build these data solutions.
Yeah, I mean, I would completely second that. This is the time to do a retrospective and to do this carefully, like Mitesh also said, right? Build for the future resilience. Like that's what countries like Taiwan and some of the Southeast Asian countries did, and they're benefiting it from that now. So we need to do the same, and whatever we've developed in this ad hoc way will not do for future. So we need to like do a careful rethink.
Very true, very true. Let's take one of the questions from the Q&A from Somik. He asks a question around outliers. One of the first steps to do in data science pipeline is to get rid of outliers. But the hypothesis is that in a situation such as COVID, everything is really outlier data. So what do you do? Srujana, any thoughts on that?
So okay, so I think outliers comes a little later when you're dealing with like it's like you're dealing with like things which are like really low level issues, right? See, we don't know about our data hygiene. Like just tell you for instance, right? Most of the data that comes in has like 20% duplicates in the cases. You don't have the luxury to worry about outliers at this point, right? Your core data itself is an issue. So honestly, to be in all of these different things that we have done, different analysis and so on, we do find that there is data that doesn't make sense. Suddenly there is a spike because somebody while typing has forgotten 1 0, right? So these things happen and we do have to detect it. But I would say like a lot of this goes into some of those basic data. It's not like a fancy ML based outlier detection. What we have in place are like some common sense rules to make sure that your data looks reasonable. That is what you have the, I would say, time to actually deal with, right? So it's not easy to do something much more beyond that when you're dealing with other more important issues.
Cool.
I don't know if that answers your question, but yeah, so we do very basic outlier detection. That's
Basic stuff goes a long way. True, very true.
basic stuff goes a long way, and that's the need of the hour, right? So once we are past that, then we can do something more fancy.
So we're almost at the end of the time. So I'll request each of the panelists for closing remarks. If they could touch upon what are their future plans and what are some important areas you would urge the community to look at, right? We'll start with you, Srujana.
Yeah, so like Harshad and even Mitesh called out, right? It's really important that we look forward and learn from this experience, not just like have the experience of having lived through it, but build on what we know. So one of the things we are trying to do is create a playbook and some code resources for future epidemic management. And right now, there's also the vaccination effort. So a lot of the things that we developed for the COVID response could probably be repurposed, like say the chatbots or some of the other utilities, right? Could be repurposed even towards this vaccination effort. And there is the future to build for. And that's in that context, I would mention the National Digital Health Mission. So this is going to, try to organize, like essentially bring some order to our health ecosystem, both on the private and the public side. So they're going to build in standards and have APIs. So it will be good if the community can contribute towards that.
Mitesh?
I think one opportunity which has definitely come out of the pandemic is this variability in how things have happened, not just across districts in our states in India, right, but across the world also, right? So we have all sorts of data which centers were able to manage things well and which were not able to do well, right? So what is it that these countries, mainly the Southeast Asian countries, right, what did they do differently? Or in what ways? And then if you look at it, it's mainly going to be about preparedness, right? I mean, they were more prepared at various levels, at the ground level in handling the pandemic in terms of having isolation centers and better testing facilities and so on, but also at the data level, right? I mean, they had more real-time data to act on, and they were more quicker on making these decisions. So you have to look at some of the best practices from these countries, right, and prepare our nation for the next 10 years to be able to incorporate these learnings, right? So what are the best practices for collecting data in health? That's one thing, as Srujana said, mostly in the, I hope in the National Health Mission, right? This is looked into, that we are systematically collecting health data, and not just collecting it one time, right? Setting up a process that it becomes a way of life, right? Anything that you do, even a small cold and cough that you go to a doctor for, that has to be recorded, and your entire patient history has to be there always and live, right? So that's one thing. And on the other side, I think the data science community now should have a good sense of what are the different tool stacks that we have, right? I mean, a lot of these are already developed, and all of us mainly relied on pulling things from different places, right? There was any time to develop things from scratch, right? But there were some things which were not available, and we were not able to really implement them in our solutions. And we have those insights into what are these missing technology pieces. So we should focus on building them for the next few years, right? And I think there's enough to learn from whatever has happened. We know what worked, what did not work, where we were lacking. And you have to get all of those insights and then keep working towards this, not in this impulse manner, right? Okay, that now the pandemic happened, all of us got together, did something, now it's gone, everyone is fine, let's just wait for the next 5 years when the next thing happens. I think this has to be a continuous process, and all stakeholders have to contribute to this, right? I mean, starting from the government to the health sector to the NGOs, and everyone have to come together and really build something which lasts for long, right? And which has a future looking outlook, right? So that's something which is required.
Thank you, Mitesh. Harshad?
Yeah, so I think one thing that I would like to point out is one thing that we've learned from this pandemic is that forecasting and prediction is good, but some things you simply cannot forecast or predict, right? So it becomes important to have very flexible systems in place that can work with completely different ways of operation and completely different data trends or data patterns, and react to these quickly. So that is where the focus on automated decision making that I was talking about in my initial thoughts comes into play. That we need to start looking at going beyond supervised and unsupervised learning and into more automated decision making algorithms.
Thanks, Harshad. Makes a lot of sense. Cool. I think we're past the hour. So let me thank the panelists once again, Srujana, Mitesh, Harshad, all of you for taking the time and joining this panel discussion. I'm sure the audience got a lot of insights out of this. So with that, we come to the end of the panel discussion, and we'll now break for lunch. And after, on the other side, there is a great lineup of sessions and talks. So we hope you all join us for the rest of the conference. Thanks once again.
Thanks. Yeah. Bye.
Thanks, Karthik.
Yeah. Bye.